Despite Dr. Fauci's prediction that masks and social distancing could be part of our day-to-day lives into next year, one Johns Hopkins doctor penned an article asserting that he believes the coronavirus could be mostly gone by April. Dr. Marty Makary, who works as a professor of surgery at Johns Hopkins, wrote in an opinion piece in the Wall Street Journal, quote, "As more people have been infected, most of whom have mild or no symptoms, there are fewer Americans left to be infected. At the current trajectory, I expect COVID will be mostly gone by April, allowing Americans to resume normal life." And joining us tonight to discuss that prediction as well as the expanding vaccine rollout is Dr. Amesh Adalja, also from Johns Hopkins University. Dr. Adalja is a senior scholar at the Johns Hopkins University Center for Health Security. Doctor, nice to see you. Thanks for joining us.
Sure, thank you for having me.
So as we approach 500,000 American deaths, your colleague, Dr. Marty Makary, wrote that op-ed in the Wall Street Journal predicting that we may have herd immunity by April. He says experts should, quote, level with the public about the good news. Dr. Fauci, as we just said, striking a different tone, saying we shouldn't get complacent. What do you think about where the U.S. will be in the coming months?
I do think that we're likely to still see cases, but you are going to see probably more declines in hospitalizations and deaths as more of the vulnerable population gets vaccinated. I don't think that we'll be at herd immunity by April. I think it's likely to be probably into the summer, but to me, herd immunity isn't the be-all, end-all. What I think is most important is taking the pressure off hospitals to decrease the rate of death and decrease the rate of hospitalizations. And I think we'll get there as we vaccinate more of our vulnerable populations. And then I think herd immunity will come later on. I think there are a lot of people that have had infections plus the vaccine. So we are seeing the virus have difficulty spreading, but it's not near the herd immunity threshold yet.
Are masks here to stay into 2022, do you think?
It's hard to say. It all depends on the trajectory. I do think that people have gotten accustomed to wearing masks. They know that they're probably going to be beneficial for influenza and other respiratory viruses. So many people may continue to wear masks even when those mask mandates end. And some businesses may want people to wear masks just because they don't want any spread. It's important to remember that COVID-19 is not going to go anywhere. The vaccine is about defanging or taming this virus. We're still going to have COVID cases 3 years from now. It's just going to be never able to cause the rate of death and the rate of hospitalization that it has in the past.
So we have multiple vaccines out now. Are they all equal when it comes to these new variants that we're still learning about?
It's a little bit hard to know exactly what all of these vaccines are going to do against the new variants, because a lot of the trials, for example, with Pfizer and Moderna, they didn't occur before these variants appeared. So we don't know. We have some laboratory data that shows that the Pfizer vaccine does have decreased antibody protection with this new variant, the UK variant, but we don't know if that's clinically significant. And the only way we're going to know that is when we see breakthrough infections. And I don't know that we will see breakthrough infections with the UK variant. The South African variant, on the other hand, some of the trials did show breakthrough infections in the Novavax and Johnson & Johnson studies. So there does seem to be decreased efficacy, but the vaccines all do equally well when it comes to preventing what matters: serious death, serious illness, death, and hospitalizations.
So what are we learning about vaccinating pregnant women and children? Those are two groups that there are a lot of questions about. We don't have results of trials in regard to those groups yet. Do you recommend that they get vaccinated?
I do recommend that pregnant women get vaccinated. We know that they're at higher risk for severe complications, C-sections, preterm labor, and the vaccines weren't studied in pregnant women, but people got pregnant during the Pfizer and the Moderna trials, and everything looks good. There's a CDC vaccine registry going on with pregnant women, and biologically speaking, the Moderna and Pfizer vaccines aren't what you would expect to cause a problem with the developing fetus. They're not live viruses like the chickenpox vaccine, for example. With children, we're doing studies right now. The Pfizer vaccine is approved for 16 and 17-year-olds, but it's going to take some time to get data in children. And remember, there's a different risk-benefit calculation in children. Children aren't drivers of spread, and children are mostly spared from the severe complications. So there is a little bit we have to think about when we're vaccinating children. There may be a different vaccine, maybe a second-generation vaccine that might be suitable for children, but the Pfizer and Moderna vaccines are being studied in kids now, but it's going to be some time before children are part of the vaccination rollout.
So there are some states like Oregon, for example, they're prioritizing teachers ahead of those 65 and older. Is that the right call to get kids back in school first?
This is very difficult because it's gotten all tied up into politics, and many teachers unions across the country have used that basically as a line in the sand that they will not return to in-person schooling without a vaccine. And you see people kind of basically acquiescing to that. But the data shows and the CDC director has said that that vaccination doesn't need to be a prerequisite for in-person schooling. We have data in many schools all around the country and all around the world where vaccines weren't in place, and this could be done safely. Unfortunately, though, this has turned into a big political mess, and this is one of the main sticking points is getting teachers vaccinated. I think teachers should be vaccinated, but I don't necessarily think that that's what they should need to get into school. I think we have the data to do in-person schooling irrespective of the vaccination status of teachers. But this is going to probably play out for some time, and I think you're going to see many states give teachers vaccines ahead of schedule just to get schools open.
All right, Dr. Amesh Adalja, thank you very much for joining us tonight.